Today is Sunday, August 8th, 2021, and this is Flashpoint. Hi, welcome to Flashpoint. After a very unusual stretch of a lot of sporting events that have kept us off the air for too long. Then again, I'm an Olympics junkie. I hope you've enjoyed these last 2 weeks as much as I have. Closing ceremony coming up tonight on Local 4. But it means we do have a lot of catching up to do. And I'm afraid as we come to you this morning, the pandemic is trying to catch back up to us. This is a frustrating position to find ourselves in. We have a very effective, widely available answer. And those who are filling hospitals and, sad to say, funeral homes are almost exclusively people who have not gotten the vaccine. Now, on the bright side, this increase in cases and hospitalizations is driving a bit of a surge in vaccinations. But left most vulnerable in all of this, our children. They can't get a vaccine, at least not yet, and it makes the start of the school year a complicated and worrisome matter yet again. In a moment, we're going to talk with the state's chief medical officer and the chair of the FDA's vaccine committee to talk about the outlook. We're also going to get caught up on matters political as well this morning after Tuesday's primary election. And a little later on, we'll remember the life of Michigan's longest-serving U.S. Senator, Carl Levin. We'll look back on a conversation of ours that seems quite timely in our hyper-divided times. All this morning on Flashpoint. All right, we're going to start today with the new worries around what is feeling like an old problem, but more and more we're coming to see that the coronavirus isn't really going away. It's here, and we're going to have to learn to live with it rather than die with it. Good to have with me the Chief Medical Officer with the state of Michigan, Dr. Janae Khaldun, back with us again, and also back with us again, the Acting Chair of the FDA's Vaccine Advisory Committee, epidemiologist at U of M, Dr. Arnold Monto. Thank you both so much for the time. I'd like to ask you both to give me your thumbnail on where you think we are on this long odyssey that we've been on, and whether you're surprised at where we've arrived, or is this the natural course of things? Dr. Khaldun, let me start with you.
You know, I'm certainly concerned about the current trajectory of cases here in the state. We got to an all-time low since the beginning of the pandemic a couple of months ago, and now, unfortunately, we're seeing our cases increase. But I'll tell you, it's not something that was really unexpected. We expect these viruses, if they're allowed to jump from person to person, we know that they can mutate, and we have seen that with these more easily transmitted variants, including the Delta variant. So I'm certainly concerned about where we are as a state. We're not seeing the rates of transmission as some other states are, particularly in the South, but I'm very concerned. I'm also concerned about where we are, given that we know the weather will soon be getting cooler.
Right.
People will start going indoors and we'll have more risk of transmission.
I'm going to imagine you share that concern as well, Dr. Monto. Tell me about where you think we are on this.
Well, I think we're concerned we would see the virus learn to transmit even better than it was, because it wasn't transmitting in a uniform way. It was occurring in clusters with super spreaders. Now we have a relatively high level of transmission. And fortunately, the virus hasn't changed so that it is still susceptible to vaccine. And there's been a concentration on the breakthrough cases, but that's not really what we should be worrying about. We should be worrying about getting people vaccinated.
In fact, that's kind of, I guess, the hard part about this is it didn't have to be this way. We got to that point where supply of the vaccine was clearly outpacing demand. Now, demand is ticking back up. We're seeing more people getting vaccinated. Dr. Khaldun, though, let's talk specifically about Detroit. For all the talk about conservatives maybe being less likely to want to get the vaccine, Tucker Carlson is not the reason why Detroiters aren't getting vaccinated. What do we do to get the vaccine rate up in the city of Detroit, where right now, my last check, it was around 36%, which is way too low?
Right. We certainly are watching closely our vaccination rates across the entire state. I also commend Mayor Mike Duggan and the Public Health Officer Denise Baird for their work, as well as many partners across Detroit and across the state for what they've been doing to assure access to the vaccines, door-to-door knocking, going homebound, having vaccination clinics in neighborhoods, partnering with churches. Those are all things that are really important. We know, to be honest, there's a history. There's a history here in this country of the healthcare system and public health system not treating Black and Brown communities well. And I think, unfortunately, that has spilled into people having mistrust of the healthcare system. And that's partly why we are having these low vaccination rates. And there's also, unfortunately, too much misinformation out there about these vaccines. And we have to really fight that.
And I think that's exactly right. And of course, we've learned so much about that divide over how we view American health care over this last year and a half. But Dr. Monto, if we look and see that Oakland County has one of the highest rates of people being vaccinated, we've got a lot of people that are just allowing that gap to worsen by not getting the vaccine that's available to them, aren't we?
Yes, and it's really tragic. You hear some terrible stories where people wait until one of their relatives gets COVID and dies to get vaccinated. And we've got the vaccine and it's ready to go and it's available. And we just need to move ahead. People are talking about revaccinations, boosters of older people. I think we'll be going there at some point. But right now, what we've got to do from an overall standpoint is get the unvaccinated vaccinated. And we need to do everything we can.
And in fact, one of the things that I keep pointing out to people is the only way that we can protect our children who are not eligible for a vaccine yet is to keep the virus from being around them. And Dr. Khaldun, that's why it's so important that everybody get vaccinated, the only way to save our children. But that moves us now into the new school year. There's at least one school district in the metro area is telling its parents that in compliance with the latest CDC advice, they're not going to be using masks or mandating masks. Now, what they meant by being in compliance is that the CDC is only recommending the masks. They're not mandating them. They're leaving it up to local districts. Should we be leaving this up to local districts? And we all believe local control in schools is really important. Or do you think that might be the wrong approach as we head into the school year?
No, I certainly agree with the CDC recommendations, which are that all schools have universal masking, students, teachers, staff. I think that's the right thing to do. That's how we're going to not just prevent spread of the virus. This is about keeping our kids in school, not having outbreaks. We're already seeing across the country, some school districts have started already, and they're seeing outbreaks, and schools have to shut back down and do virtual again, which is not what any of us wants, not what I want as a mother as well. So I think people need to understand the CDC recommendation is actually for there to be universal masking in schools. And if that is not happening, that is not actually the CDC's recommendation.
We know there are a number of schools that are not going to be doing that. Dr. Monto, as from your perch on the vaccine committee for the FDA, what do you think the outlook is right now for what's the earliest that you could see us possibly being able to vaccinate children under the age of 12, which right now we don't have?
I think that's going to be a little more complicated than the move to vaccinate down to age 12. That was done as an amendment. It didn't require anything but studies with the same dose of vaccine. They're looking at lower doses. They're looking at other things to make sure that the vaccine passes the risk-benefit guidelines, because we don't want to see side effects as we go down in age, and there might be side effects. That's why our committee recommended larger studies in young individuals to get the vaccination approval down to age 5. It's going to take a little while because it has to be done carefully. Remember, people are complaining that we move too fast, and that's the reason they don't want to get vaccinated. We're moving at the right pace to deliver a safe vaccine to our population.
Well, and we've been told, Dr. Monto, that the outlook for full approval, which many believe might make a difference to a number of Americans, could come in September. Is that a reasonable outlook?
From inside and outside information, yes.
And Dr. Khaldun, what kind of difference do you think that will make? Because right now we remain on emergency usage for this vaccine. What difference would it be if it was fully approved by the FDA?
No, I think a full approval would be really important. I think more businesses or entities would be likely to mandate the vaccine. Or quite frankly, I think more people would just want to get the vaccine on their own. So I think it would actually have an impact on our vaccination rates.
Let's hope so. I so appreciate having both of you here, two leaders on this, not only in the state, but with what's going on nationally. Thanks so much for your time. Stay safe, and I know we'll talk to you again very soon.
Bye.
You bet. So long, Dr. Monto, Dr. Janae Khaldun. We continue. We'll talk about politics.